Once again at the Roses Restaurant in New Jersey took place the Armenian American Health Professionals Organization, APO, annual meeting and board elections, which began with Dr. Lawrence Najarian opening comments. Mr. Najarian presented the APO members and board members with the 2018 annual report. Mr. Najarian's APO's president said, quote, APO was founded in 1994 by 3 individuals with the dream that Armenian healthcare providers could work together to improve the health of our communities, both in the tri-state area and in Armenia. Khoren Albandian, registered pharmacist, John Nersessian, MD, and Nabet Kasabian, MD, were novel in their approach, and unlike many medical organizations at the time, they allowed all healthcare providers to join, not just physicians.
So I joined APO when I was still a resident. I had just finished medical school and I was starting my training as an OBGYN. And so I wanted to get a knowledge of all the other doctors in the community. And actually I was very lucky when I joined APO, they actually helped me find the job that I have today. So through networking and fellowship and all the other activities that we do, I developed a good relationship with all the other Armenian doctors in the area. So we have two separate parts of our mission, and one is to help Armenians that are in the U.S. and the other is to help Armenians in Armenia. And so I actually personally am on the committees to helping the group, the Armenians in Armenia. So like the medical mission is something that's close to my heart. I've actually been a co-leader of the group in the past, and personally I want to enrich that program and to eventually extend how much care we assist our Armenians in Armenia with.
Dr. Arthur Kubikian asked those present to introduce themselves. Setan Albandian, wife of one of the founders of APO, late Khoren Albandian, who continues to be active supporter of the organization, read APO's statement.
Our mission, APO's mission, is to improve healthcare awareness, increase disease prevention and early detection, foster fellowship and career development of Armenian healthcare professionals, and provide medical support and education to both our local communities and Armenia.
Dr. Garbis Baidar, the treasurer of the organization, presented the financial report of 2018. Dr. Baidar also spoke about the success of this year's mentoring program, which drew larger than ever attendance. APO organizes mentoring program with AESA, the Armenian Engineers and Scientists of America, and other Armenian organizations. Dr. Pierre Maljian, temporary president of APO's board member election, read the election results. Dr. Deborah Ann Furman was elected as a new board member. Dr. Furman, hematology oncologist, graduated from the Johns Hopkins University and completed her medical degree at the New York University School of Medicine. She is a recipient of the Humanism and Professionalism Award, author of 2 book chapters on thrombocytopenia, and currently works on staff at the Queens Cancer Center in Jamaica, New York. She has also participated in 4 medical missions to Armenia and is a valued member of the APO family. Dr. John Belazikian summarized APO's CME credits and medical program during the Armenian Heritage Cruise of 2019. Dr. Kunadi Khachadurian-Meyer reported on several medical workshops organized by the Armenian American Health Professionals Organization for the Armenian community involving many different doctors. Dr. Lawrence Najarian also spoke about the new APO initiatives and programs, including the Emergency Referral Service Hotline, Scholarship Program, CME Program, and Outreach. Taline Gergarian gave social media email report on behalf of Judith Lee. Dr. Joyce Kurdian and Dr. Lucy Tovmasyan discussed the medical mission, Facebook page, and the APO 5K run. The annual board meeting concluded with the closing comments of Dr. Rafi Hovanesyan. He explained that his active involvement in the work of APO is not only connected with 25 years of important medical mission of the organization, but also the lifelong friendships APO has helped to create.
APO is an organization where medical professionals from all different professions get together on a regular basis, and the first motto of our organization is really to serve others. And since we are all healthcare professionals, we're basically serving the needs of Armenian community, both here in the tri-state area and in Armenia. in every healthcare aspect. So we are very proud to do that. It is a voluntary organization, but we have accomplished so much in the last 10 years that I've actually been a board member of this organization, including going on missions to Armenia in rural areas where there is a high need for primary care, including educational meetings here locally, including training physicians from Gharabagh to come to Yerevan and update their medical education. So there is a lot happening, and what's nice about the organization is that you can find your passion and you can find your devotion regardless of what your field you are in, and volunteer in that, because as I said, we have so many options that you can participate in. And I think that's a very unique aspect of our organization, where if you like to travel to Armenia, you can do that, or if you like to help locally, you can do that. So there's no excuse for any medical professional really not to join this organization, where actually everybody has become good friends and there's a great camaraderie in the organization as well. So we hope always to increase our membership and to always raise awareness of what we do.
APO has grown from a twinkle in founders' eyes to an impactful organization with robust programming, fulfilling each element of its mission statement, fostering fellowship and career development, increasing healthcare awareness and early detection, and providing medical support and information to our communities here and in Armenia.